Hi everyone, my name is Amanda Lai, and I'm so excited to share my findings on my review paper that I researched answering the question, how can dance be used as a therapeutic tool in treating aging diseases? And I just wanted to give a special thank you to my mentor, Chen Chao, for guiding me throughout this process. So as a quick introduction, I am a senior at Irvington High School located in Fremont, California, and I'm interested in studying biology, sports medicine, and global health. I am an advocate for access to mental health resources on the high school level, and I am a competitive dancer, training in contemporary lyrical jazz, ballet, and point. And on the right, you can actually see an image of me from a Nutcracker production at my local studio. So in terms of the objectives of my study, I hope to analyze the function of dance movement therapy in general clinical settings, consider integration options of dance movement therapy in rehabilitation and treatment programs for patients with aging diseases, as well as a general goal to address and respond to setbacks of therapy intervention, and spread findings to inspire individuals to take part in dance as an active exercise form. So I first would love to begin with kind of introducing the term aging-related diseases, which I refer to as aging associated with various health risks and diseases due to increased molecular and cellular damage within the human body. And specifically, I targeted kind of my analysis on Alzheimer's disease and Parkinson's disease, which I'll later discuss. So Alzheimer's disease is a neurodegenerative disease that slowly destroys memory and cognitive function, interfering with daily life and activities. The ability of neurons, which are specialized cells that process and transmit information via electrical and chemical signals, is impacted, which really impairs the ability to communicate for patients with Alzheimer's disease. And the effects extend to a widespread degradation in brain function and eventual death in neurons, which is seen in the visual on the right. And going on to Parkinson's disease, it is one of the many diseases associated with aging, and it is a brain disorder that causes unintended motor control movements such as tremors, stiffness, as well as difficulty with balance and coordination, once again noticed with the visual to the right. And the symptoms associated with Parkinson's disease are rooted in the loss of neurotransmitters, notably dopamine. And I'll also be discussing the chronic respiratory diseases, CRDs, and obesity with its impact and correlation with dance. These are leading causes of global morbidity, notably among the elderly population. Both of these yields persistent symptoms of skeletal muscle impairment and muscle limitation. And CRDs impact the airways and overall structure of the lungs, while obesity is a chronic disease defined by excessive fat deposits that impact health overall. It is directly linked to an increased risk of type 2 diabetes and heart disease, overall leading to complications in bone health. Heart failure and hypertension was also one thing I noted throughout my research. As you can see on the visual, kind of the difference between a hypertensive heart and a normal heart when thinking about hypertension. These are also severe public health concerns in the United States, affecting about 25% of the elderly population. Now, kind of introducing ways where we can combat these aging diseases, I analyzed creative art therapies, also known as CATs. And these are an innovative way to prevent stress. And this definition kind of encompasses different art forms such as music, dance movement, and drama therapy. Now, kind of pinpointing to dance component of CATs, dance movement therapy is defined by the American Dance Therapy Association as a psychotherapeutic use of movement to promote emotional, social, cognitive, and physical integration of the individual for the purpose of improving health and well-being for the overall individual. Now, looking at the actual impacts of it, physical activity in the dance form is an effective behavioral lifestyle intervention, and it is associated with blood pressure, in the reduction of it, improved physical mobility, and better quality of life. And as traditional pharmacological interventions are limited in impact when used as monotherapies, dance serves as an effective complementary therapy that induces sustaining effects, which I'll later discuss. First, considering the neurological scale, dance as an activity really involves complex coordination among the physical, cognitive, and rhythmic systems, which overall fosters a mind-body connection accompanying music or other form of rhythm. Thus, it has advantages over traditional repetitive strength and balance programs that are often provided as a standalone therapy. And I analyzed one study that kind of looked at a cultural dance program targeted towards Native Hawaiians and Pacific Islanders, and displayed that hula dance as a dance form enhanced hypertension control, supplemented with the use of music and rhythmic motions. And in correspondence with music to the dance program, it overall, once again, enabled the integration of the mind and body systems. And kind of a visual of this on the molecular scale, exercise in the dance form induced transcription, and it is triggered by the activation of inducible DNA binding transcription factors. And pictured here, you can see there's different three kind of steps involved in transcription, with the first one being the translocation of mRNA, the messenger RNA, then with translation, and having mRNA have an increase in the selective binding points. And this has tangible impacts on the larger scale for stress and anxiety. So as a creative art, dance had tangible impacts in the reduction of such. In all studies analyzing dance movement therapy or dance interventions, stress signs were significantly reduced amongst its subjects. And this stress was tested with saliva samples to measure cortisol levels, which I found really fascinating with the research process. It serves as an enjoyable form of movement for patients, increasing the quality of life through managing stress and anxiety levels. Furthermore, for patients with dementia and Parkinson's disease, dance was seen to increase social interaction and enjoyment among residents and care staff once effectively incorporated as a complementary therapy. Nowadays, it is gaining popularity as a community-based intervention, with specific models that promote community inclusivity. So fun and exciting activities are, of course, a necessity within our lives. And this incorporated in a dance movement therapy program is incredibly effective and have different adjustable factors, such as including different activities targeted towards the patients with Parkinson's disease that can address the motor symptoms. And I would then love to transition to the physical implications of dance movement therapy. The first one being gait and mood improvements. So dance styles range from quick and fast movements to slower and calm styles. So the options for dance interventions are vast, leaving room to address various symptoms. Regions of focus can include movement initiation, postural control, walking, flexibility, social interaction, and even perceived degree of fun. And some tests utilize a 6-minute walk test, post-integration of dance therapy, and noted an increased gait speed and resistance. Individuals diagnosed with Alzheimer's often have gait impairments, and appropriately adjust dance therapies and intensity would help treat gait and balance deficits. Similar relevance is notable for patients with Parkinson's disease, who may observe gait change due to bradykinesia, limiting motor control and body movement range. So dance serves an important role to ease patients back into movement in a light and moderate release style and transition. And in terms of blood pressure, dance movement therapy has been associated with improved systolic and diastolic blood pressures, an increased VO2 max, and overall exercise capacity. And studies have shown that social support and music lowered blood pressure and helped improve stress management. With increased blood pressure being associated with an aging risk, dance is an accessible treatment to improve these blood pressure levels and really help with a decrease in cardiovascular risk factors, rooted in a reduction of the lipid profile. So as a rehabilitation method, dance targets patients with poor cardiovascular health and effectively supports integration into more intensive activities. However, of course, I wanted to make sure I considered the limitations of dance movement therapy in the medical environment. So the first kind of limitation I encountered was cost and accessibility, as a session with a dance movement therapist falls between $60 and $140 an hour, which serves as a limiting factor for those seeking professional treatment. However, in comparison to traditional pharmacological interventions for treating aging diseases, dance movement therapy yields valuable outcomes. The second limitation I observed was kind of the intensity levels, which weren't really suited towards individuals of patients with Parkinson's or Alzheimer's disease. So that's why we really have to consider the application sense of adjusting intensity per patient and having a level of personalization. So dance as an art form and movement has varying regional definitions, proportionally differing in purpose and program. Therefore, as we enter the field of medicine and the integration of dance movement therapy, you really have to be open to kind of adjusting each program to the individual to meet their needs and capacity. And I really wanted to bring up a real life example of this with integration as we see today. And in response to the COVID-19 pandemic in 2020, we've really seen an increase in accessible options for dance movement therapy, such as an organization known as Rejoice in Motion that encourages anyone in the world to join these virtual sessions that incorporate dance movement therapy to promote wellness through dance. Thank you so much for your attention, and I hope you really enjoyed my findings on the integration of dance movement therapy in treating aging diseases, and I would love to open up to any questions.
Thank you so much, Amanda. What a cool presentation. And I also know that there's actually another dancer in among our audience members. So Neha, who just joined, actually does traditional South Indian dance too. So hopefully you guys can connect afterwards. I'm actually curious. So you talked a lot about how dance movement helps with aging diseases, but I'm also curious whether there are also benefits for young people like yourself and other dancers. What are some of the benefits in addition to sort of lowering stress levels for younger dancers?
Yeah, definitely. I definitely found various research that connected the impacts like neurologically and physically, such as, like you said, stress and anxiety levels being better managed, but also the community sense offered through dance. And I myself, I've been training in dance since the age of 3, and I'm 17 years old. So I definitely saw the real effects of dance as kind of the extracurricular or constant in my life that improved my physical well-being as well as on the mental scale.
Very cool. And I'm also curious, as you move on to, finishing up high school and college, how are you thinking about balancing your dance career and, whatever you plan on majoring in?
Yeah, definitely. So I've been thinking about this specifically as a rising senior, or currently as a senior going to college soon. So I hope to really integrate dance as an active form of exercise in my life, supplemented with my studies, hopefully pursuing medicine in the future, kind of balancing my academics and that side by really allocating time each day to involve dance because I find it as a really enjoyable form of exercise.
Very cool. Thank you so much, Amanda. Great presentation.